I think we're going to move on then to Dr. Chung Koo Kim, who is the president and chairman of the Jeonbuk Medical Association. And he will present on community care and telemedicine at Jeonbuk Medical Association. Thank you, Dr. Kim. The floor is yours.
Thank you. It is an honor to be able to participate in World Bio Innovation Forum. I'd like to tell you the community care and telemedicine. Next, please. Next, please. Yes. At Jeonju City, 2019, healthcare, the title was healthcare, and 22 is the title was safety network care, and that contains was chronic disease care and home care and telemedicine. Next slide, please. Next slide. Jeonju Medical Association had held a geriatric symposium at August to educate and to explain the community care project. Next slide. 50 subjects were participated. They received comprehensive geriatric assessment through the preliminary evaluation, 29 sheets by nurse of Community Service Center. Next, please. The first step process of healthcare is comprehensive geriatric assessment was done by nurse of Community Service Center. And the second step is subjects were visited to clinic, and then doctor make decision of treatment and care plan. And then at the Community Service Center, they provide community care service according to the total community care plan. Next, please. This is example of the preliminary evaluation, 29 sheets. Next, please. Next, please. Next. 2022, the title was Safety Network Care was done. Next, please. The total subject were 475 subjects, and participated and include 12 clinics, include OBGYN doctor and psychiatrist. Next slide, please. Our organization consists of one doctor and one team director and 2 team members. We had meeting monthly and community for each quarter. Next, please. The subjects were classified first to 4th stage by the states of health disease condition. The first stage had received the home intensive care and visit communication and telemedicine. Next, please. Next, please. Classification was done at Community Service Center. Next, please. The project performance was done according to each stage. At fourth stage, home intensive care was received, and visiting medicine, communication, and telemedicine was done. Next, please. First to third stage, they received education of hypertension and diabetes. The subjects were 407 subjects. The contents was education of hypertension and diabetes, and dietary therapy, and exercise therapy, and medication communication. Next, please. The contents of education is disease education and dietary nutritional education and exercise education and administration of medication by pharmacist. Next, please. This picture is disease education and exercise education and medication education. Next, please. And 34 subjects visited to clinic. They received the physical examination and education and comprehensive estimation and blood test and comprehensive control plan. They received customized education and communication was done. The subject of fourth stage, doctor visited to the home of 101 subjects of fourth stage. Next slide. Next. The telemedicine was done who classified fourth stage subjects, and 2 months later, after the home care, the communication was supported by community care center member because of they usually have hearing difficulty and speaking disorder, cannot easily use the mobile phone. To strengthen health monitoring of the subject by sharing non-face-to-face medical chart record with the community center. Let me see the case review. The first case was all day living in a state of bed because he repeated attack of cerebrovascular accident. 2 months later, after visiting medical communications, telemedicine was done with his wife, nursing of bed sore, monitoring of blood pressure, medication condition, and counseling with his wife. The second case, subject with diabetes, severe diabetes, need intensive care management. 2 weeks later, we explain of the blood test result and check the hypoglycemic event and complications and recommended lifestyle modification. Next, please. And third is people with a skin problem who have difficulty moving due to knee and hip joint arthritis. Telemedicine was conducted after 6 months of the home care. It is a chronic skin disease between the scalp and forehead. It is a stressful condition. A dermatologist without good response. And then he was management of the affected skin according to the description of skin performed at the time of visiting treatment. After checking, the area was improved. He was under high stress for a long time due to skin disease, but after improved, subject satisfaction is very high. Next, please. This slide shows patient to doctor and doctor to patient telemedicine. This is a telemedicine record chart. Next, please. This is the first case of telemedicine. He attacked repeated cerebrovascular accident, so he leaving all the bed. And his wife with telemedicine was done. And second case, severe diabetes patient. And he had a long time skin disease. Next slide, please. I'd like to tell the advantage and effectiveness of telemedicine. The first focus is medical accessibility increased and cost effectiveness. Many elderly people with mobility difficulties can conveniently receive and telemedicine can increase the promote patient relationship and subject to field development of medical system and have a psychological stability about their health condition, increase the mental and physical states. And the subject and the guardians can ask a free question to doctor, so they feel their convenience and quality of medicine improved. Also, satisfaction of quality of medical communication is elevated. Next, please. Our project had experienced the limitation of the telemedicine. So many elder subjects has a hearing difficulty and speech disorder. The mediator must help in the communication and communicate the content. It can maybe poor communication. And as an elder person, telemedicine is impossible because they are not good at using of a smartphone and video call function. So the mediator must need and help. If the prescription is not stored at home, it is difficult to check the current medication. So it is difficult to distinguish medicine through the telemedicine. Next, please. And the severe diabetic patient was received the same as stage 4 subject. They received 28 people to content for education at home and clinical blood test and telemedicine, and dietary and nutrition education, and exercise and medication education was done. Next, please. The effectiveness and advantage of intensive care of diabetes. They can obtain the specific disease of information of diabetes and can prevent the hypoglycemic event and complications by improving dietary habit and improve the medication compliance and improving lifestyle modification. And they were medical satisfaction increased to provide customize the education of diabetes. Next, please. In Korea, we have a lot of problems of telemedicine, such as platform operator, and it is really medical safety and technical safety. We have questions, risk of misdiagnosis and medical accident. Does it have the same clinical effect as face-to-face care? The question of clinical effectiveness. So we have to shoot our clinical trial. The patient group should be organized in consideration of gender and age and severity of disease, and clinical trial should be conducted. A policy effectiveness question is improving access to medical care, achieving risk and cost effectiveness goals for our consuming of medical care, and concern about the concentration of large hospitals is very, very important. And concern over the collapse of the medical delivery system and collapse of primary medical institution. And then legal problem. The legal responsibility for misdiagnosis and medical accident rests with the doctor in accordance with Article 34, Paragraph 3 of the Medical Service Act of Korea. We wish systemic maintenance of legal responsibility problems is required. Next, please. Our medical reports, community care project reduced medical expenses by 1.70 million won per month for each subject. Thank you for your attention. Thank you very much.
Thank you, Dr. Kim, for that excellent presentation. Is there a question for Dr. Kim?
Yes.
Dr. Kim, so I'm Dr. Lee from Seoul National University Bundang Hospitals, the family medicine physicians. So I think your activity was just like very similar with the Atrium community virtual care. So, it is common sense, common thing that if a physician and medical staff continuously monitor the patient, so the patient condition will be improved. So, but I think in South Korea, the problem is there is no policy and the reimbursement from the government, the healthcare insurance program. So I'm asking you that your community care center based treatment protocol and by the Doctors Union Association is very I think is very respectful, very great. So I'm very curious about the budget. So did you supported by the government for the visiting patient home and consultation? So it maybe took lots of time, the time consuming for your physicians. So rather than visiting the patient home, so seeing outpatient in your clinic is more beneficial for your business. So what do you think about that?
Thank you for your attention, our project. And the first, we will start it, the city of the chairman is applied to our government, and that was success there. So we have to do it. So, but the first time we worry about it can be well done, but so many physicians cannot participate. They do not want. But I was pushed to them because
of
I'm
dedication, yeah, devotion.
Okay, I was president of JMA, so they followed me. But the project started after them. They were very satisfied,
Sure.
the patient and Dr. Boris.
Yeah.
Oh, really, the doctor, how to management to care of patient is the comprehensive assessment was really needed. Just to looking the symptom, just looking the scar is not. The elderly person needed to comprehensive assessment was needed. We realized that. So this community care project was very important to the participated clinic. So we'd like to more chance to another physician near clinics needed to participate this project. And the telemedicine, following telemedicine was very good, and satisfaction was increased, physician and patient both. Especially they feel the mental and physical stability we had experienced. So we want to, the two legal problem will be systemic maintenance of responsibility problem will be resolved.
Yeah.
Yeah.
Well, thank you for that great question.
Thank you, Dr. Kim. Yeah.
Thank you very much.
Thank you. And thanks for an excellent presentation.